So we're going to get started now. I am Dr. Rita McGuire, and I am so excited to have you all on the webinar this evening. We are streaming live. So if anyone's on Facebook Live, you can put your questions there as well. And those who are linked into the Zoom, you can put your questions in the chat box. So I'm Dr. Rita McGuire. I'm the Chief Medical Officer here at Wakana, one of the co-founders. And tonight is the doctor's edition. Tonight is when healthcare professionals or even lay people can tune in to really understand what CBD is, how it differs from marijuana, and how it works in the body. And we'll then discuss some of our amazing products that we have here at Wakana. So a little bit about myself. I am an obstetrician gynecologist. So I deliver blessings into the world. I usher blessings into the world. I'm also a surgeon. So I do hysterectomies and C-sections and oophorectomies and liposuctions and tummy tucks. I attended Wayne State School of Medicine in Detroit, Michigan. I completed my residency right here in Chicago at Cook County Hospital. I'm CEO of RJM Wellness and Rip Rita Fitness. I'm a global women's health and wellness speaker. I'm also a certifying physician for the medical marijuana program here in Illinois, as well as a member for Doctors for Cannabis Regulations. And again, I'm one of the 4 co-founders of Wakana and the Chief Medical Officer. Well, I want to introduce you to my colleagues, the colleagues for the Medical Advisory Board. We have a board that's made up of healthcare professionals, physicians, nurses, chiropractors, dentists, clinical psychologists, naturopaths, licensed clinical social workers, and therapists. So all of these healthcare professionals absolutely advocate and believe in using cannabis, CBD, for those who are looking for alternatives to their health. So what happened in 2013, 2014? Well, Dr. Sanjay Gupta, who you all know, came out and made a statement. You know, he said, in 2009, I said no to pot. I said there was absolutely no medicinal benefits to the cannabis plant. But he came back in 2013, 2014, and you know what he said? He said, I didn't dig deep enough. I didn't look at the research. I didn't travel the world like I traveled. I didn't seek out patients who absolutely have gotten medicinal benefits from using this plant. I didn't talk to scientists in other countries. I didn't speak to lab specialists and research experts. And he said that we have been systematically misled about this plant. And so when Dr. Sanjay Gupta came out with this announcement, that's when all eyes were on this plant. All eyes were on this plant because folks are looking for alternatives to their health. So let's look at the difference between hemp and marijuana. So many of you may know hemp by maybe you get some smoothies with hemp in it, or maybe you've gone to the health food store and you've seen products that have hemp seed or hemp oil. Well, hemp is the industrial form of, or the more of the agricultural form of the cannabis plant. Yes, it is one of the species of cannabis. But what I love about hemp is that hemp doesn't give you a high. It doesn't have the psychoactive component like marijuana does. See, marijuana gives you the high, it gives you the euphoria, it gives you the paranoia. It even gives you the munchies, right? But what differs between hemp and marijuana is the amount of THC. See, THC is the compound that gives you the high. And this is why when you use marijuana, you get high. It's because of the THC component. Whereas hemp has such a small amount of THC. In fact, by definition, hemp only contains 0.3% or less. And this is why hemp doesn't give you the high, but it gives you all of the health benefits. So hemp is legal. Yes, hemp is legal. Yes, it's one of the cannabis species, but because it contains such a small amount of THC, it is legal to cultivate and grow in all 50 states. So again, when we look at the difference between hemp versus marijuana, just know that hemp contains the legal limit of THC. In fact, in 2018 is when the Farm Bill was passed that removed hemp from being a Scheduled I drug. A Scheduled I drug are drugs like LSD and marijuana and all those illicit drugs that have no medicinal properties. They have very high addiction properties, and they have very concerning safety issues. Well, hemp was removed from being a Scheduled I drug, and now it's legal to consume as well as grow and cultivate in all 50 states. So again, when we look at CBD and THC, yes, they're both found in the marijuana species and the hemp species. But again, the difference is that THC gives you that high and CBD doesn't give you the high. It gives you the health benefits that we're going to talk about this evening. So let's look at many of the health benefits of CBD. CBD is antibacterial. So that's why you're seeing many CBD products that are used in facial serums and products that can help with acne and eczema and psoriasis. CBD inhibits cancer cell growth. That's why you're seeing so many oncologists and cancer physicians that are utilizing CBD to reduce nausea and vomiting in patients that are undergoing cancer treatment. CBD is neuroprotective. You're seeing many neurologists that are using CBD in their patients that have had strokes, or maybe they have seizures, or maybe they have some neurological or neurodegenerative condition where the nerves have been damaged. CBD can come in and protect and repair those nerves. CBD promotes bone growth. You're seeing so many orthopods, orthopedic surgeons that are utilizing CBD in those who have had fractures. CBD reduces seizures and convulsions. It reduces blood sugar levels. It does that by reducing the amount of inflammation in the cells of the pancreas that produce insulin. CBD, again, reduces the function of the immune system. You're seeing rheumatologists, you're seeing endocrinologists that take care of patients that have autoimmune conditions like lupus and fibromyalgia, multiple sclerosis. They're using CBD to assist with the immune system. CBD reduces inflammation. It reduces the risk of arterial blockage. Cardiologists are looking at the therapeutic use of CBD and helping to reduce the blockage in arteries. CBD also reduces the small intestinal contractions. We're seeing GI docs using it in those patients who have ulcerative colitis, irritable bowel syndrome, Crohn's disease. CBD, again, reduces nausea and vomiting. It relieves pain. You know, the number one reason folks are using CBD is because they are in pain. They're utilizing something that can assist with those symptoms that we see in folks who have arthritis or neuropathy or sciatica. CBD helps to relieve anxiety. How many of us out there have anxiety? We're stressed out about this global pandemic. We're stressed out about this Omicron variant. We're stressed out about what's going on financially in the world, the unrest. CBD helps to slow bacterial growth. It suppresses muscle spasms. Very, very important in those who have multiple sclerosis. It treats psoriasis and other skin disorders, as we talked about earlier, because of its antibacterial component. And it is vasorelaxant. It helps to improve blood flow to important organs, especially in those who have high blood pressure, hypertension, or those who may have erectile dysfunction because of the decrease in blood flow. So CBD is truly the hero, right? There are other compounds, or what we call cannabinoids, that the cannabis plant makes. Other cannabinoids like CBG and CBC. You see them here in the slide, delta 9, delta 8, THC, THCV. See, all of these cannabinoids or compounds also produce benefits to the body. So when you use a product that's a full spectrum product, a product that contains all of these amazing cannabinoids, we truly have seen so many with positive results on the body. So speaking of the body, our body produces cannabinoids just like the plant. You'll see on the left side, these two cannabinoids the body produces are anandamide and 2-AG. And they're endogenous, so they're called endocannabinoids. We see anandamide and 2-AG in very, very high levels in breast milk. So you know when you have a baby that's breastfed, those are the happiest and healthiest babies around. Why? Because they are getting their mom's endogenous cannabinoids. So our body produces cannabinoids, and you may say, well, Dr. Rita, why do we need to take CBD if our body already produces compounds just like the plant? Well, the reason why we have to take CBD is because our body is really faced with a lot of external stressors, right? From the environment, with pollution, the air, the water we're drinking. Let's talk about the food we're eating. Let's talk about all the processed food that the Western diet has. All of these things causes a reduction or deficiency in our endogenous cannabinoids. And this is why we need to take CBD every single day. So when we look at Americans and we look at the age groups and we look at the areas in the country that are utilizing CBD, we really see that those age groups that are utilizing CBD the most are really those baby boomers, right? Baby boomers are utilizing more CBD than ever before. We have aches and pains and other issues that we want to address. So let's get into really how CBD works. CBD works by a very scientific, physiological system, right? And we know that many, many people that we love and care for are on lots and lots of medication. So folks are really looking for alternatives to their health. We're not saying or advocating that they stop taking their medication, but this is truly great information for those who are looking for another, as I call it, another tool in their toolbox for their health. So again, the reasons that folks are using CBD are relaxation, stress, chronic pain, relieving muscle pain, improving sleep, treating migraines, offsetting nausea, spiritual use, skin care, those who have very painful menstrual cycles, sexual enhancement, and of course, treating seizures. So let's get into the science, because when I was introduced 4.5 years ago to CBD, it wasn't something that was taught in medical school or residency. But when I looked at the data and I looked at the research, I asked about the science. Well, how does it work? It works through this physiological system that we all have. It's called the endocannabinoid system. This is a system made up of receptors. As you see in the middle here, receptors that are found throughout our entire body, from our head to our toe. There are receptors looking for what? They're looking for cannabis compounds called cannabinoids. When we ingest CBD, these receptors, when we ingest THC and the other cannabinoids that we talked about, these main receptors, CB1 and CB2, that are on target organs like our heart, our lungs, our liver, our kidney, our skin, our stomach, these receptors then bind with the CBD and send signals to different areas that put the body back in balance. That's how the endocannabinoid system works. This system was discovered in the early 90s when I was at Wayne State School of Medicine. And again, many medical schools are not teaching about this system, but just know this is the science behind how CBD works and the other cannabinoids work. So we talked about that CBD is legal through the 2018 Farm Bill. It was an agricultural bill, but as long as the product is sourced from hemp and contains the legal limit of THC, which is 0.3% or less, it is legal in all 50 states to consume, to cultivate, and even to sell. Now, the FDA has approved only one CBD pharmaceutical medication. It's called Epidiolex. See, Epidiolex is a drug that is used for childhood seizures. Seizures like Lennox-Gastaut syndrome, Dravet syndrome, tuberous sclerosis complex. This is a medication that costs around $3,200 a month, but it is a CBD FDA approved prescription. It's the only one on the market. So when we look at CBD interacting with other drugs, because many people are on pharmaceutical medications, it's important to know that it could negatively interact. It could cause medications that you could be taking to work less, or it could cause medications that you're taking to work a little bit more. Just know that because CBD is metabolized in the liver, and many drugs are metabolized in the liver, it's important to let your physician know. And that's why we have this call, hoping that many physicians and healthcare professionals will get on this call to understand the drug-drug interaction. Another thing is CBD and drug testing. Does CBD show up in your drug test? Many people are still undergoing random drug screens, and because CBD is a cannabinoid, it potentially could cause a drug screen to be positive. So this is why we have different formulations like broad spectrum and isolates for those who undergo random drug screens. So this is a study that actually showed that if someone was using a CBD product that had the legal limit of THC, theoretically, they would really need to take large doses daily, doses between 1,000 and 2,000 milligrams to theoretically cause a urine drug screen to be positive by 11 to 23%. And this is why it's very important that if you have urine drug screens at your job, that you use our topical products or you use broad spectrum products that do not pass the blood-brain barrier, that will not cause that urine drug screen to be positive. So you have a lot of urine drug screens out on the market, right? You can go to Walgreens, you can go to CVS, you can get these little kits. But what's unfortunate about these kits is that they're not very sensitive or specific, right? these rapid, or what we call point of care urine drug screens, it's just like a pregnancy test when you go to Walgreens or CVS. Sometimes you can get a false positive and you're not really pregnant. Sometimes you can get a false positive and you're not taking THC. And so that's why it's really important that you really talk to your employer. There are very sensitive urine drug screens out there that truly will pick up someone who is using CBD versus someone who is using THC or marijuana. So 5 things you should know before buying a hemp-derived CBD oil. One thing is that you always want to purchase CBD from a reputable company. Not all CBD is made equally. Right now, you can go to any gas station and probably find a CBD product. Now, would I trust that CBD product? Heck no, because many of those products are not tested. Many of those products are coming from who knows where, right? So it's important to know where the hemp is grown. Is the hemp grown organically? Are the farms organic? How is the CBD extracted? How is the CBD oil extracted from the biomass of the plant? Are the products third-party validated, third-party tested? So what is inside matters the most, because when you deal with a product that's not tested or not sourced from an organic farm, or maybe it's made in somebody's garage or kitchen, you could potentially have a product that has mold, mildew, heavy metals, pesticides that could absolutely harm someone who is immunocompromised, someone who may have cancer, someone who may have an autoimmune condition, someone whose immune system is not very strong. So choose a brand like Wakana that stands behind their products. Our products are tested, our products are sourced from organic farms, and our products are extracted in a very clean extraction method, which is called a supercritical CO2 extraction method. So again, because hemp is a bioaccumulator, that means that it will accumulate whatever in the soil. It really matters where that hemp is sourced from, where that farm is, and are they growing it organically? Again, the extraction method. We use the cleanest extraction method, CO2 supercritical. There are many ways to extract CBD, but we use one of the cleanest and most efficient. Third-party testing, yes. All of our products are third-party tested. All of our products undergo testing for potency, testing to ensure there's no mold, mildew, heavy metals, pesticides. All of these things are important. We have certificates of analysis on all of our products. So what are the different ways of consuming CBD? Well, there's tinctures or oral applications. There's vape cartridges or smokables. There's liquid forms or water-soluble forms. There's edibles, gummies, there's capsules, and topicals. And we have and offer all of these different forms of utilizing CBD. So let's get into some of our products. We have, again, very safe, very effective CBD products that, again, undergo third-party validation and are we provide certificates of analysis. Now, this FDA disclaimer is super important, right? Because the FDA does not approve any of these statements. Why? Because CBD outside of Epidiolex is not FDA approved. So these products and these statements made regarding these products have not been evaluated by the Food and Drug Administration. The efficacy of these products have not been confirmed by FDA-approved research. These products are not intended to diagnose, treat, cure, or prevent any disease. All information presented here is not meant as a substitute for or alternative to information from your healthcare practitioner. Please consult with your healthcare professional about potential interactions or other possible complications before using any product. The Federal Food, Drug, and Cosmetic Act requires this notice. So we have tinctures. Tinctures are products that you use underneath the tongue 2 to 3 times a day. We have a power line. Those are the products that are in the black label. Those are our full spectrum products. And then we have our pure line. That's our broad spectrum products. The difference between pure or power and pure is that our power products contain the legal limit of THC, which we talked about, which is 0.3% or less. The pure, which is our broad spectrum, contains less than 0.0% or less of THC. So our pure products are recommended for those who have random drug screens at their job, and our power products are for those who do not undergo any random drug screens. We have formulations that are anywhere from 300 milligrams to 900 milligrams of CBD, depending on the level of severity of the challenge that you are addressing. We also have a product that's water soluble. Our Power Water Soluble here is a great product that you can use in your juice, your smoothie, any liquid like water or tea. And then our tinctures, again, are used under the tongue twice a day, and ensuring that you have optimal bioavailability to the cell. When you're using a tincture, it's important to hold it underneath the tongue for about 60 seconds before you swallow. Some of the other benefits in using Wakana products is that we have proprietary formula on many of our products. We've enhanced the CBD with essential oils like black seed and turmeric. These are essential oils that address antibacterial, antifungal. They assist in digestion of the kidneys, liver, blood sugar levels, cholesterol. Turmeric, we all know, is an amazing essential oil and herb that reduces inflammation. It helps with heart benefits and enhances emotional well-being. Our carrier oils include our MCT coconut oil and hemp seed oil, and they really help carry the CBD into the cells. Our topicals are amazing products. Our topicals offer local relief. Our #1 seller in our company is this product here, our Extreme Power Pain Cream. It's 400 milligrams of CBD, and it's a great product to assist with symptoms that come from having arthritis or sciatica or neuropathy, offering local relief to those sore areas in the body. We also have a product called Dr. Rita's Rub. It's our liquid formulation that will also assist in those symptoms. We have products that are great for aging, define that aging, those wrinkles. It's a facial serum with CBD. We have also edibles. We have our gummies. We have a CBD coffee. We have products that help to detox our bitter teas. We have amazing edibles. And what's different and unique with our gummies, that our gummies are not coated, they're infused. So you're really getting more potency when you have an infused gummy. We have a full spectrum gummy, our power gummy. We have our broad spectrum gummy, our pure. We have our Delta 8 gummies. We have our gummies that address libido and stamina. And we also have products for weight management. We have essential oils. All of our essential oils are organically grown. I'd like to pay special attention to our first defense. That's our nasal spray. Not only does it have CBD, but it also is enhanced with essential oils. And with a nasal spray, what I want to bring attention to is that you are absolutely putting it in an area where viral and bacteria loads can get into the body. So this is a great, great product to utilize during this time of year. We have smokable products. We have pre-rolls. We have cartridges. We even have a premium flower for those who like to roll their own CBD. You may ask, why would someone want to smoke CBD? What are the benefits? Well, two main benefits, one being that smokables act quickly. They get into the body and the bloodstream within 1 to 5 minutes. The second benefit is that those who are smoking nicotine, they're smoking cigarettes, CBD is shown to reduce the cravings, reduce the withdrawal for all of those that are still smoking and want to quit smoking. So when we look at the kitchen, we're looking at the holidays, right? We have products that can spice up your recipes. We have spices. We have a vegan butter. We have a product that you can bake and cook with your favorite brownies and cookies and cakes. Just know that when you're cooking with CBD, not to cook over 350 degrees Fahrenheit. Why? Because you may just burn off the amazing benefits of your CBD. And you may also, if you cook higher than 350 degrees Fahrenheit, you may have a bitter taste. And you don't want a bitter taste to your favorite recipes. Our hair care is a very important line. There is another global pandemic, and I call that hair loss. Yes. Men and women all over the world are losing their hair. Why are they losing their hair? Well, one reason is because of the COVID infection. The COVID infection can cause something called telogen effluvium. It is a temporary loss of hair and hair thinning, but just the stress of the virus on the body has caused many to lose their hair. So we have a system called Save Our Strands. This is a system that utilizes CBD. We talked about CBD and its benefits in reducing inflammation, reducing bacteria. This is an amazing line that includes shampoo, conditioner, detangler. We have a styling cream, and we even have a product for men that may have lost their beard volume. We also have products for the home and your office. We need to keep and continue to keep our surfaces clean. We have a virus defense. It's great for hand and surface. We have a produce wash. We have a hard surface cleaner. We have products that use quaternary ammonium to help to address this virus. Sexual health is a big thing, right? During this pandemic, there have been more couples that are stuck at home together. So these are amazing products that enhance those bedroom activities and those that address deficiencies, right? So we know women that are menopausal, postmenopausal, maybe even premenopausal, perimenopausal, that have vaginal atrophy, vaginal dryness that causes very uncomfortable intercourse. We have those men that need improved blood flow to the penis, to the testes. We have gummies. We have a CBD lube. We even have sensual body butters to keep us in the mood. So we've got so many great products. You can't go wrong. Wakana, we are the crown jewel of CBD. Just know that CBD is another tool that you can use in your toolbox to address your health. I want to thank you all for attending. If you have further questions, you can always reach out to me. My email is ritamd@wakana.com. I want to invite you to our business overview. Dr. Joy Smith will be hosting the next webinar, the Zoom webinar. It's at 8 p.m. Central Standard Time. That is the Zoom code, and the passcode is there. The Zoom ID and passcode is there. You want to hop on this call if you want to hear more about our products, our opportunity, and the leadership behind Wakana. I want to thank you for attending. Be well, be safe, happy holidays, and we will see you back here next Tuesday evening at 7 p.m. Thank you, and God bless.